So the first thing we're going to look at is the difference between health disparities and health inequalities. Health disparities are basically the difference in health status among distinct segments of the population, right? Now, these health disparities, we hear a lot about health disparities in research, in the news. These do not just come out of nowhere, right? Certain groups of people aren't just born with different prevalence or disproportional experiences of certain things, right? A lot of times health disparities come arise from health inequities, right? So health inequalities are the result of systemic, avoidable, and unjust economic policies that create barriers to opportunity, right? So, for example, let's take diabetes, something that's in my family, something that's in the African American community quite a bit. Now, a lot of times there's some Black people with diabetes. I think it's one of the things that our community have at a more prevalence rate. Now, that's usually because due to diet and other factors. And so when we look at diet, we also want to look at lifestyle. We also want to look at access. And then the map starts to become a little clearer, right? I like to say that disproportionate findings, like in your statistics or your data, is the signature of an oppressive system. Why is it that one group has something far more than the other, right? There's probably something systemic going on. So let's do something I call the 5 whys. It's really profound, and hopefully this activity will stay with you anytime you're trying to describe social determinants of health. And it's going to be our yellow brick road into system-centered language. So I'm just going to read this narrative to you, and we're just going to ask why 5 times. And you'll see that the whys get us closer to a larger, how did this come to be? Okay. Let's say Melanie is in the hospital. Why? Because she has a bad infection in her leg. Why does she have a bad infection? She has uncontrolled diabetes. Why is her diabetes not under better control? Well, she hasn't been taking her prescribed medicine. Well, why is she not taking her prescribed medicine? She can't get to her appointments regularly, and she can't afford her meds. So at this point, it seemed like Melanie's a little negligent, not taking care of her health and not staying on top of her well-being. Let's keep on down this causal chain with a few more whys. Why is she not going to her clinics and taking her meds? Her neighborhood is unsafe, and there isn't access to affordable transportation or reliable childcare. Now we know a little bit about where Melanie lives and the fact that she's either a mother or an older sibling. Some childcare is needed for her. Here's our last why. But why did she get diabetes in the first place? She eats cheap, unhealthy food. Why didn't she eat healthier? Because she lives in a food desert and has poor understanding of health and nutrition. One area under the social justice umbrella that is booming, that I'm really excited that is taking off, is actually food justice and climate justice, right? Usually minoritized folks are more likely to live in food deserts and to live next to power plants or factories or where there's more smog or congestion. And so this might be a larger part of her diabetes than just being flippant with her health. Okay. Take a moment. Ask yourself if you would have asked that many whys and where you probably would have dropped off of the narrative of Melanie and what conclusions you probably would have made about Melanie, and most importantly, how that would have impacted your care of her. Right?